Welcome to Prep and Play, where we have conversations about safer sexual pleasure. This podcast is dedicated to empowering listeners through open, honest discussions surrounding keeping our minds, bodies, and spirits healthy while being sexually active. My name is Danielle Sturdivant, and I'm the Rural and Minority Outreach Specialist at AIDS Alabama South, and today I have with me...
Hey everybody, I'm Rachel Carter. I am the Director of Clinical Services at Shell Health Clinic at AIDS Alabama South.
Awesome. And today we're going to be talking about the basics of viral STIs. And we talked about bacterial STIs in our last episode. And the difference between viral and bacterial STIs is just simply the mode of transmission. Viral STIs are obviously caused by viruses. And these are super important to understand as far as sexual health go. A lot of these are usually more misunderstood than bacterial STIs, and so we'll be talking about a few today. The first one that we'll be discussing is human papillomavirus, or HPV, which is not always an STI, but we'll be considering it as it is sexually transmitted. It is primarily through vaginal, anal, or oral sexual contact and can be spread through skin-to-skin contact in the genital area. Many people don't show symptoms of this. It can be asymptomatic, but possible symptoms include genital warts, an abnormal Pap test result, or cervical or anal cancer.
Yeah. So HPV is a tricky one. There is a vaccine now for HPV that covers a good amount of the strains of HPV, but not all of them. So again, just regular routine exams is the best way to know whether or not you've come into contact with HPV, or if you have any, symptoms of the warts as well, and then just using regular barrier method protection to prevent it. But one of the biggest things to understand with HPV is that males are carriers. They carry the virus. There's no way to test a male for HPV unless they end up with a wart and they do a biopsy and the biopsy comes back, which this is not something that people generally do with warts. Usually if a wart is present, we get it removed and we go on about our day. But for females, it's completely different because there are strains of the HPV virus that can lead to cervical cancer for females. And so it is extremely important for females to stay up to date on their annual Pap smears, which I don't know why we call it annuals anymore because you don't have to have it every year, but on a regular basis, at least every 5 years if you've never had an abnormal Pap. It used to be that they did recommend females to have Pap smears every single year. And they also started recommending Pap smears when females were extremely young. And now that age has been pushed back depending on sexual activity amounts. But the reason is because HPV, when it is present in a Pap smear, sometimes it can cure itself. It can go away. It's not something that a female is going to live with or deal with for the rest of their life. But it is something that needs to be kept an eye on just to make sure that it doesn't advance into anything more serious like cervical cancer. So HPV, yes, it is tricky, but just make sure you get your vaccinations if that's something that you believe in and that you like to do for yourself. But biggest thing is use protection and get your regular screenings done.
And so that Pap smear is the only test that would be able to discover an HPV infection, correct?
Yes, it is. An actual Pap scraping of the cervical cells to see if they come back as abnormal or not. And if they are abnormal, then they do further testing on that to see what exactly is causing it to be abnormal. That does not mean, though, if you go in for a Pap and you have abnormal results that you automatically have HPV or cervical cancer. There's a lot of things that can cause cervical cells to be a little abnormal. But again, that's why it's good to go in, get it done, and they can do further testing and analysis to see what exactly is going on.
While we are discussing that there is no real test for this, it is important to note that the estimates are that around 85% of people will come into contact with HPV in their lifetime, which isn't to scare you. It's just to let you know that this is extremely common. And while it can cause cervical cancer or abnormal tests, or usually the presentation of this is not life-threatening. It's usually just a simple wart that goes away on its own. And that is important to mention because there is no actual cure for the virus itself. So treatment focuses on managing symptoms, which can be removal of the warts via medication or cryotherapy, and then regular pap smears.
Yes, exactly.
Next up, we have herpes simplex virus, HSV, otherwise known as just herpes. This one is spread through direct skin to skin contact with an infected person. And there are two strains of this virus. We have HSV1, which typically causes oral herpes or cold sores and is often transmitted via kissing or oral sex. And HSV2, which typically causes genital herpes, transmitted through genital contact. And I do say typically because I do understand that it's not always that cut and dry, right?
Not at all. HSV1 and HSV2, it's good to know which one you have, but it's spread the same exact way. So herpes it affects all mucous membranes. So you can literally get a cold sore, fever blister, whatever you want to call it, a herpes vesicle on any mucous membrane on the body. So that's why we tell people barrier methods are best, because if there is an outbreak of herpes, a lot of times individuals don't know until they're having these blisters or these open sores that are really painful when really they were already contagious a few days before. So barrier methods are wonderful. And then after, if you know that you have a cold sore or if you are having any type of an outbreak, you don't want to have contact with anybody else skin to skin until it is completely healed. And this goes for even yourself. So if you have a cold sore, we're going to talk about one on your lip, on the face, and you are putting on some medicine to help it from not hurting so bad, and you're touching it with your finger, and then your eye itches and you go up and you scratch your eye, you can pass the herpes virus from your mouth to your eyes. It's easy to pass, it's quick to pass, it's very contagious. So you just have to be careful and mindful about it. If you have any type of an outbreak when it comes to that, just hand hygiene, no sex, and limit your physical skin-to-skin contact.
Okay, and so you mentioned that those sores or blisters, those are the most common symptom, either in the genital or oral facial area, which I say oral facial because that can be mouth, nose, eyes, any mucous membrane on your face. And then also during an initial outbreak, there may be flu-like symptoms such as like fever, swollen lymph nodes, stuff like that. And you did mention that barrier methods like condoms and dental dams are the most effective at preventing spread and then avoiding sexual contact during outbreaks. But as you were saying, you know, those outbreaks usually begin before those sores are present.
Yes. So a lot of times people will say that they might have had like some itching to the area, a little bit of burning, or they just felt like the area was hot before they ever even had the actual outbreak. And so those are just things that if you know that you're going to have an outbreak, go ahead right then and there and just start, using extra precautions so that you don't spread it. But it is a virus, so that's why, you get like the swollen lymph nodes or you're not feeling well. And a lot of times people will have an outbreak when they're coming down with some other illness, or maybe they're just on overload of stress and their immune system is down some. Maybe they've been traveling a lot, not sleeping the way that you're supposed to. Anything to affect your immune system. And when that goes down, that's generally when the virus will come to peak or an outbreak may occur.
With most of our viral STIs, we usually think of those as treatable rather than curable. With our bacterial STIs, we usually think of you take this treatment and you're cured. With viral, we tend to focus on managing symptoms. So how do we typically treat herpes?
Herpes is treated by an antiviral. There's a couple of them. Valtrex is one of the most common, especially for genital herpes. And it's taken for, depending on that person and how often they have outbreaks, they may take it for 10 days just to get rid of that current outbreak. But there are options for both Valtrex and the other medication, acyclovir, that you can take the preventative dosing and just take a smaller dose every single day. So if you're somebody that has frequent outbreaks, or their immune system is just not great, or they're just overly worried and want to make sure that they're not getting these outbreaks, the preventative dosing is an option as well.
Awesome. And I do just want to note that, when we were talking about these bacterial STIs, we were talking about things that could lead to infections further in the body when they were, if they're left untreated, things that could lead to infertility, things that could lead to serious health complications. With herpes, you're dealing with a skin condition. And I think that's so funny how this one is one of the most talked about and one of the most feared, when the worst thing that's going to happen is those blisters.
Yes. And another thing, and this is something that I remind people of all the time. So, being that it is a virus, if you want to get a blood test for herpes and that blood comes back as being reactive or positive, that does not mean that you have herpes. That means at some point you were either exposed to the virus of herpes, or maybe you had a cold sore on your tongue that you just ignored and thought your tongue hurt for a minute. It doesn't mean that you have genital herpes and that you are going to pass it to everybody in the world. So just be mindful of that as well, that the blood test for that does not show an active infection. It's an antibody screening only. And there are a number of people that may have an outbreak once in their life and then never again. So it is extremely common, but it is not the end of the world. And it's definitely not what Google makes it out to be.
And the next, there are some that are a little bit more serious. We have the hepatitis. So hepatitis A isn't technically a sexually transmitted disease. Actually, not technically. It's literally not sexually transmitted. But I didn't want to talk about hepatitis B and C and just skip over A. So I will just note that hepatitis A is usually spread through contaminated food or water, E. coli in the water. But hepatitis B and C can be sexually transmitted. So those are super important to talk about. So hepatitis B can be transmitted by blood, sexual contact, or from a mother to a baby during birth. Mm-hmm. It can be asymptomatic, but symptoms can include jaundice, fatigue, and abdominal pain. The hepatitis are essentially liver infections. Am I correct there?
Yeah, they affect the liver.
The prevention for hepatitis B includes that vaccine and the use of condoms and avoiding sharing needles, because blood is one of those primary routes of transmission. And since there is a vaccine for hepatitis B, it's nowhere near as common as hepatitis C. But we do have antiviral medications that can be used for chronic cases. What is the typical treatment for hepatitis B?
The antivirals. So there is a number of them, and it just depends on the provider and what they prescribe for the person. There isn't one that's better than the other. The biggest thing though is to just know whether or not somebody is vaccinated, and then secondly whether or not they have had a previous infection of hepatitis, and that's going to also depend on the treatment method as well. But yeah, the easiest way, because there are 3 different hepatitises, and one of the ways that I always remember them, like hep A, have that A as like you think of just abdominal or anal because it's passed through fecal matter and things like that. And then hepatitis B, blood and body fluids. That's the easiest way that you can think how that one's passed, and what it's caused from. And then hepatitis C, we think of with cirrhosis of the liver. So that's what causes cancers and cirrhosis is hep C. But those are just like easy tricks if you ever hear the word hepatitis on which one exactly we're talking about. They're all preventable, but there is the vaccine for that one as well as hepatitis A.
And so you did mention that with hepatitis C, you think of cirrhosis. Mm-hmm. So is that one usually more damaging than the other two?
So hepatitis C, it spread the same way, but a lot of times hepatitis C can also be brought on just by alcohol consumption. And so it does affect the liver in different ways depending on person's lifestyle, not necessarily just with sharing needles or, unhealthy sex practices, anything like that, which a lot of times hepatitis C is just kind of thrown into that bunch with it. But really, it can be caused by a number of things that affect the liver, and drinking, heavy drinking, alcoholism, things like that can really have an effect on hepatitis C. But it is treatable, hepatitis C, and that does not depend on how it was contracted. It's literally just the virus alone is treatable, but also it can treat itself. So there are acute hepatitis C infections that occur and the body will cure itself of it. So again, regular testing, screenings to get done, and just knowing the type of lifestyle that you have and ways that you can protect yourself are the best when it comes to hepatitis.
Mm-hmm. And you mentioned drinking as well as the blood-to-blood contact for hepatitis C. And that's one of the reasons we put so much emphasis on testing when we go into treatment centers, especially for hepatitis C. And again, like Rachel said, a course of antiviral medication can treat this.
Yes. Yep.
And last but certainly not least, we have human immunodeficiency virus, or HIV. I like to always point out that this virus, so much of understanding this virus can just be broken down by looking at the name. So you have immunodeficiency, it makes the immune system deficient. And then human, which means anyone in the human race is eligible to get this virus.
Yes.
I don't like to think of priority populations. I like to think of like if you've engaged in any of these behaviors, you are eligible. So it can be transmitted through blood, semen, vaginal fluid, rectal fluid, and breast milk. We always say there's 5 bodily fluids. I like to say there's 5.5 bodily fluids because it does say semen, but I want to make sure we're understanding that pre-ejaculate can also transmit the virus.
Yeah.
Just because he didn't come doesn't mean there's no risk, guys.
Yeah.
So common routes include unprotected sex, sharing needles, from mother to baby during childbirth or breastfeeding, which is becoming less common with our current treatment, correct?
Yeah.
All right, so symptoms. An acute HIV infection can include flu-like symptoms like a fever, sore throat, and then chronic HIV can actually be asymptomatic, but may lead to AIDS if untreated. And then AIDS is acquired immunodeficiency syndrome, which is just a term that means that your helper T cells have gotten so low that they're not able to fight off common diseases. And we are going to talk so much more about HIV in our HIV 101 episode. We're just giving you the bare basics here.
Yes. So HIV has a huge stigma around it. But the thing is, HIV is easier to treat these days than somebody coming in that's diabetic or has uncontrolled high blood pressure. And you don't hear anybody complain or say like a specific person has, that because of their lifestyle or they did this wrong. And HIV has that, people put so much blame on people for having this, and it should not be that way. It is preventable, yes, but we all live, so things happen. And just like she said, the ways that it is spread through the blood, the semen, vaginal fluids, rectal fluids, breast milk, just use condoms, regular testing. Don't share needles for 1,010 different reasons. And when it comes to mother and baby, during birth and breastfeeding, we have found ways around that. Mothers are delivering babies, healthy babies, all the time now when they've been living with HIV for many, many years. The acute infection is just like any other virus, just like we talked about before with the herpes virus. Anytime your body is exposed to a new virus or something that it's not supposed to be in contact with, or it's kind of come into the body when it wasn't supposed to, it goes into this fight mode. So that's what causes your lymph nodes to swell up and you to run a fever and not feel well, be very fatigued because your body is just in overload and it's trying to fight is the best that it can. But that's what causes that acute stage of symptoms when it with the HIV infection. And then it leads into the chronic stage, and many times there's no symptoms whatsoever and people will just go on with their daily life and maybe stop in for a random HIV test and have no idea when they came into contact with it. So get tested. Know your status. That's the most important, because we can get you living and doing things just like normal. We just need to know your status.
Yes, and we can get you to a level of undetectable where you can no longer
Absolutely.
transmit the virus. This
Yes.
isn't a death sentence or something you're going to have to pass on to all of your partners.
Not at all.
And then as far as prevention goes, one important thing that I have to mention is pre-exposure prophylaxis, which is a medication taken to prevent HIV if you are to come in contact with it. It can be a pill once a day or a shot every other month. And those are over 98% effective?
Mm-hmm.
98% effective at preventing infection if you come into contact with the virus. Considering that, and again, like I said, the antiretroviral therapy can control the viral load and prevent progression to AIDS and reduce transmission risk. So while some of these are considered so big, bad, and scary, they are treatable, and there are ways to manage all of these.
Mm-hmm. They are. And yeah, they don't affect just one type of person. Anything and everything that we've talked about in this can affect all of us and any of us at any time, but they are all preventable. We can treat them. We can do the best that we can. And as we were talking about the PrEP for the prevention, there is also the option for a post-exposure. So just like if you were thinking about pregnancy, PrEP would be like that birth control pill. PEP is going to be like the plan B. So maybe you weren't on PrEP, or maybe you forgot to take your PrEP for 3 months, whatever it might be. and you had some unprotected sex, there is an option to get some medication to take so that if you did come into contact with somebody that is living with HIV and is not doing their treatment the way that they're supposed to, it will protect you.
Awesome. And, talking about that pre-exposure prophylaxis, that is why I decided to name this show Prep and Play. Because, again, pre-exposure, that just means before you come into contact with them. Prophylaxis is just a method of protecting you from some type of infection or condition. And so all of this show, listening to these ways to protect yourself before you play, is prophylaxis to me. So Prep and Play. Just to recap, we've gone over HPV and herpes, which are both transmitted through skin-to-skin contact. We've gone over the hepatitis, which are blood and sexual contact, and HIV, which are those different 5.5 bodily fluids.
5.5.
5.5. Don't forget pre-ejaculate. And so this really just goes to show the importance of regular testing, getting vaccinated where possible for HPV and hepatitis A and B, and then safer sexual practices. There's no such thing as 100% safe sex, but, throwing a condom in there could make you a little bit safer.
And regular testing.
That's really the biggest because, once we can go from there. Mm-hmm. All right, so that's all for today. Thank you guys for listening. Thank you, Rachel, for stopping by. Join me next time when we will be discussing all about HIV. Bye.